Good morning, everyone, and welcome. Welcome to our news event. Thank you for your patience, and thanks for joining us this morning. My name is Mark Wyatt. I'm Assistant Deputy Minister at the Ministry of Health. I'm pleased you could all join us for the launch of a new online tool that will greatly benefit the people of Saskatchewan. Thank you for your assistance in allowing to do this event in person while ensuring the safety of all of the participants and guests. Once we've heard from each of the speakers, we will invite questions from you from a seated position, and our speakers will be pleased to answer those questions from the floor. Leading our announcement today is the Government of Saskatchewan's Minister of Health, the Honourable Jim Ryder. Welcome, Minister Ryder, and over to you.
Thanks, Mark, and good morning, everybody. Thanks for being here today. Today marks a significant organ and tissue donation milestone. Many of you know someone who has needed to receive an organ transplant or is a recipient. Whether the transplant is needed due to an injury, illness, or other medical condition, many lives have been saved because someone made an important decision to donate. You've probably heard of the legacy left by Logan Boulay of the Humboldt Broncos, who has been a major influence on increased donor rates in Saskatchewan and right across Canada. Logan made a critical decision prior to his death to register as a donor. He also had a conversation with his family, so they were aware of his decision. From the terrible tragedy of the Humboldt Broncos crash came the news of 6 Canadian lives saved and the beginning of the Logan Boulay effect. I want to acknowledge that young but very mature and selfless people like Logan have influenced many others to make this same important decision. Our government has been working to improve other areas of the organ and tissue donation system, including the appointment of Dr. Joanne Kotchuk and other donor physicians. In 2021, we committed $1.2 million in funding to support the expansion of donor physicians and donor coordinators in Regina, to increase transplant rates and continue efforts to increase public education and awareness. After hearing the viewpoints of many advocates, we knew improving organ and tissue donation rates and reducing the transplant wait list was a significant priority for our government. Today, I'm pleased to announce that the Government of Saskatchewan has officially launched an online organ and tissue donor registry. I encourage everyone to take the time to visit givelifesask.ca. The registry is a convenient online tool that allows people to easily register their decision to be a donor. The information placed in the registry, including name and health card number, is secure and will only be accessed by specific healthcare providers and only in the event that donation becomes an option. Any Saskatchewan resident 16 years of age and older with a valid Saskatchewan health card can register to become an organ donor. I want to applaud everyone from the organ and tissue advocacy community for the important work that you have all done in the development of this registry. Thank you for your vision and for your commitment to this initiative. Once you've registered, please talk to your family so they're aware of your decision. Without family consent, organ and tissue donation cannot move forward. When the registry went live this morning, I registered my choice to be an organ donor, and I'd encourage everyone else to do the same. Thanks very much for your time this morning.
Thank you very much, Minister. Now I'm pleased to invite our next speaker, Lori Garchinsky, who is Executive Director of Provincial Programs and Tertiary Care for the Saskatchewan Health Authority, to say a few words. Lori?
Thanks very much, Mark. Minister Ryder, ministry colleagues, Mr. Foe and Emily. Good morning. Saskatchewan is a province that prides itself on community support, volunteerism, and giving, and today allows that spirit of giving to continue. As a registered nurse, I've spent my career in critical care and cardiac settings and have been involved in a number of situations where tragic events have occurred in the lives of Saskatchewan families. This is certainly not a situation anyone can prepare for or imagine impacting their loved ones. However, this announcement today will allow one small but important wish to be made known. I've also been impacted by patients and families who have been faced with the realization that the only opportunity for recovery has been based on someone else making a decision to support organ donation. These individual lives are changed when someone else chooses to make an end-of-life gift. So having a provincial registry will ensure that these wishes are known It will also help those who are considering living donation as an opportunity to take that first step in the journey. The Saskatchewan Health Authority has worked closely with the Ministry of Health to enhance our organ donation program. Through the leadership of Dr. Joanne Kotchuk, our administrative teams in Regina and Saskatoon, and many other healthcare professionals provide spanning ICUs, emergency departments, cardiac care units, operating rooms, and transplant teams, we've been able to provide life-giving chances to many people. This registry will provide our SHA teams one more important tool in the organ donation process. We believe, as Minister Ryder has shared, it will continue to spark conversations with individuals and families about end-of-life wishes. We know that organ donation is a very personal choice, but ensuring that others know that choice when you're not able to speak for yourself is vital. Having those conversations with loved ones when there is no stressful decision to make is key to ensuring that our wishes are known. Participating in this registry will also ensure that your wishes are known when you're not able to speak for yourself. So we're really grateful to have the opportunity to partner with the Ministry of Health in this registry and look forward to ensuring that this work supports the goals and vision of the organ donation program within our province of Saskatchewan. Thank you.
Thank you very much, Laurie. And now I'd like to invite our final speaker, Mr. Blaine Poe, to say a few words. Mr. Poe is based here in Regina and is an advocate for organ and tissue donation. We're grateful to have you, Blaine, Mr. Poe, join us today to share your family's experience. He plays an important part in our ongoing public awareness efforts to improve donation rates in Saskatchewan. Thanks again for joining us, and welcome to our event.
Well, thank you. I'd like to thank the government of Saskatchewan and the Ministry of Health for inviting me here today to share a bit of Michelle's story. And although it's a tragic and a sad one, I'm also very excited to be here because I'm excited about this new organ donor registry. I do believe that this new tool will save lives. So for me, today's a wonderful day. I get to honor my late wife, but I also get to be part of this exciting news. On Labor Day morning, 2018, exactly 2 years ago today, my family and I had the horror of waking up to find that the most important person in our life was suddenly taken from us. This was easily the most difficult day that anyone in my family has had to endure. Michelle was on the kidney transplant list because she had suffered irreversible damage to her kidneys as a result of lupus. She was very resilient. Michelle was very, very resilient, and with the help of her doctors, they actually had put the lupus into remission, but unfortunately, the damage that it did while active meant that her kidneys slowly began to fail on her. But while she was on the transplant list, we had a plan, and our plan was simple. We waited, we prayed, and we did everything we could to live as normal life as possible. And although her condition was serious, we never expected that this would be the outcome. Along her journey, Michelle was so fortunate to have the doctors and nurses working with her. And I want to take just a brief moment to thank some of them. I want to thank Dr. Van Tommy, her family doctor. I want to thank Dr. McDougall, her rheumatologist. And I want to thank Dr. Abdelhadi, her nephrologist. I also want to give a massive shout out to the nurses at the transplant clinic. All these people are incredible. All these people love their jobs, and we know that because they loved on our Michelle. So today I don't have time to share her story and do it justice, but I do want to share that Michelle was a loving, kind, gentle, and beautiful wife and mother who was making a difference. She was making a difference at home. She was making a difference in her school where she taught for 20 years, in her community, and at her church. If I could boil it down, I would say when we lost Michelle, we lost a wife and a mother, which means we lost our superhero. But these superpowers were not just with Michelle. They're in all of our wives. They're in all of our mothers. And I believe their greatest gift is the power of love. You see, when you lose a mom, you lose a superhero who knows exactly when to give us a hug. But not just when, what type, because there are so many types of hugs for different situations. When you lose a wife, you lose a superhero who knows when to grab your hand, to diffuse a situation, to take away fear, and sometimes just to remind us that we're loved. When you lose a mom, you lose a superhero who knows what to say and when to say it. Someone who knows when you need them and when you need your space. But it's not all sugar and love, because superheroes are tough. When you lose one, you lose someone who's not afraid to put you in your place, because we all know we need a ton of correction. So we can plan, we can pray, and we can prepare for the future, but we have no idea the path that it will take. This is a very personal and very important decision. All that I ask is that you take it seriously. It is so important and so critical, because registering for the donor list means that we have more lives that we can save. It is such a gift to give life. Register to be a donor. Save lives.
Thank you very much for joining us again and telling your story and the story about Michelle. We really appreciate it. In conclusion, as the message has been delivered many times, we encourage everyone to go to givelifesask.ca to register. And now we have some members of media in the room, and our speakers are available to take your questions. We might just ask you to speak loudly so everyone can hear the question, and direct who you would ask to respond. So open to the media group.
Yes, as it stands right now, what percent of people in Saskatchewan are registered to be organ donors?
I'll get Mark to add to this. I think right now, because of the process, the way we're doing it, there's a sticker you can put in your health card, but there's no central registry. I don't think we actually have a count on that, and that's one of the important things that this registry will do. It'll give us an opportunity to have that central registry and have that kind of data.
Yeah, I don't have anything more to add to that. Knowing whether somebody has put a sticker on their card and talked to their family is a personal decision that each person is making individually. And now we will have the data that will be able to tell us how many people are registered through this database. There's really no way of knowing what the take up has been in Saskatchewan right now.
We'll stop using the sticker system, and we'll go strictly to the central registry. So again, we would ask everybody to register online, and it's still very important that they make sure that their family knows their wishes, because if that time comes that they're being considered as a donor, the medical professionals will still be checking with family members. So it's important twofold, right? The registry is very important, but it's important that people also communicate that to their family members as well.
On that subject, can you just elaborate a little bit on the ability of a family to say, hey, I don't want there to be this donation occurring. So if I register for this and I tell my family that I don't want this to happen, if I pass away, are they able to still veto my wish to donate organs?
You're getting into sort of a legal issue, and I'm going to ask Laurie if you touch on that as well. But my understanding, that's why it's important that this is sort of a two-pronged approach, that you let your family members know. I think in most cases, medical professionals will still defer to families' wishes. But we know from data we've seen across the country that in the vast majority of cases, if the wishes are known to the family, and that's where the central registry is going to be so important, that I think it's in excess of 90% of families will honor those wishes. Right?
Thanks very much. Yeah, I would agree. The registry, actually, if there is you, for example, in a situation where we are having end-of-life discussions and we are progressing down that road, it gives the organ donation coordinators the opportunity to, at that point in time, then go into the registry and look up what your wishes are. That then allows the opportunity when we are approaching your family member to say, you know, your loved one did express interest in that, and as Minister Ryder has said, often that is an opportunity then to say, we understand those wishes and we would like to support them. The conversations are absolutely key, and I think the work that has been done in the registry to allow for the ability to email some of the folks that you are interested in making sure those wishes are shared with is really important. And you know, much like with the story we heard with Logan and others, you need to have that conversation at the dinner table. You need to have that conversation at the lake or in the hot tub or wherever it is where it isn't stressful. You're having those discussions, because end-of-life situations when you're sitting in an intensive care unit or an emergency area and people are coming to ask you those questions is very different when they have a sense of understanding of what you wanted, as well as a registry to say, yes, this was your wishes, that you were interested in being an organ donor.
If I could just add to that as well, then back to the numbers we were talking about earlier, I'm told that in other jurisdictions the numbers bear out like this. If the discussion hadn't happened with family and someone would be an eligible donor, less than half of families allow for their loved one to be a donor. In cases where they're known ahead of time, their intent's known ahead of time, it's about 90%.
So I'm not sure I caught all of it, like how important it is for someone to consider.
Yeah, because some people are like some people don't know if they should make that choice to become a donor, whether they're trying to make that decision for themselves or they aren't having that conflict with the family and the family might not be convinced yet. So maybe you can about that.
I'd just like to say that it's a very personal decision, and everyone owns that decision for themselves. And I think that people need to. My ask is that they just take it seriously, and they think about it. The way I like to look at it is that if we just pause and think about if someone close to them couldn't be with them anymore, if someone close to them passed away, just what kind of impact that would have on that person. And because that's what happened to our family. And for us, it's just clear that if we could give life to someone else so that their family doesn't have to suffer, we would do that. So I think it's very personal. It's up to the individual. And I think they need to make the decision that's best for them. But they also need to consider how many lives they can save by doing this. And I think it's up to 8 lives for every individual that donates. So yeah, there's nothing that could be more important to our family. We can't get our Michelle back, but we do not want any other moms to go before they're supposed to.
Are you doing it? Go ahead.
Thanks. So when individuals put the sticker on their health card, certainly in an event where, you know, there's been a significant health injury, that patient comes in, they're obviously registered with their health card, but that health card could be left in their pocket. From a standpoint of families, we try to say, please take your belongings, your loved one's belongings home with them. If that conversation hasn't happened and you're in an intensive care unit or, in an emergency room facing a life-threatening situation, likely those family members aren't going to remember, if those conversations haven't been had, to look on somebody's health card in the midst of all the other conversations and discussions that have to happen. This now does modernize it. If we are coming down a road and the determination has been made that unfortunately we're not able to save an individual, and our organ donation team is triggered in that situation by the processes that we have in place, they will now have access to look it up and actually approach families then in situations to say, did you know that Lori actually had expressed witness interest? She had put on the registry that she wanted to be an organ donation. And that opens the door for a bit of a different conversation than having to have a sticker, which at the time, it was an intent. This just does allow us that opportunity to modernize it, as you said now.
I think it's one of those things that just over time it's just become more front of mind for the public and obviously for the government. I know for myself it's been for a number of years. I made a phone call this morning to a good friend of mine who in 2006 had a liver transplant, and he's around today because somebody was generous enough to list themselves as a donor. He referred to this as a great day, which Blaine did earlier, and his family suffered a tragedy a couple of years ago. So I think as technology improves, the type of transplants can be done. You see the organ donor registry. I think it just speaks to just how important this is and how important it's going to continue to be. And this is just another step in what we've been doing to build the infrastructure. We've hired the organ donor physicians, the coordinators. You see the registry. You're going to continue to see this being a priority for our government. I did mine this morning, and it literally takes a minute, 2 minutes. You list your name, your health card number, your email address, and I might be missing something, but it's not much more than that. It's very quick and simple to do.
If I could just add to the Minister's answer, there's also some frequently asked questions and other information on the website. So if you have a question about the registry process, about the decision you have to make, there are other resources that are linked from the same site. So there is some additional information for people to support their decision-making process.
And Mark, if I could add,
Yeah,
it's also important, the date of birth. On that as well. We know that in Saskatchewan, from time to time, there are people that have the same name, and we want to make sure that from that perspective, your health card number, that date of birth is really important, so that we know that you are the person who is actually registering, and we're able to validate that as well.
I would just add, I would just encourage everyone to do it. It literally took no time at all, and then it's over, it's done. Speak to your family so that they know your wishes, and if almost everyone in Saskatchewan would do it, it would be incredible the number of lives that we could save.
Blaine, do you have any closing words before we wrap up?
Closing. I get to close?
Go ahead.
The minister here, wow. I'd just like to close with this. If I couldn't be here and I register for this, my family would know that there's up to 8 people that I continue to live on with. I think that is a gift that is beyond anything else. So if people are struggling about how this would work, I just would like them to think about that. You can't be here, but your family knows that you're alive in up to 8 different people, saving their lives and improving their quality of life. This registry is a gift to us. I think we need to use it.
Thank you very much, Minister Lori and Blaine for joining us, and to the media, thanks very much for coming out to this event, and we really do encourage everyone to deliver the word about the registry and to take that offer up on your